So it's my honor to introduce Dr. QURESH MASKATI sir, who's a moderator of various WhatsApp groups, and with his wonderful sense of humor keeps things in check and moderates how we behave and make sure we don't go overboard with things on WhatsApp. So sir will be talking on WhatsApp do's and don'ts.
Slides. Maskati. Load नहीं हुआ
Tom? अच्छा ठीक है, that's okay.
ये लगा ना? Morning. So I'm talking on WhatsApp use and abuse, and most of us are prisoners of WhatsApp. We wake up in the morning and the first thing we'll reach out for is the cell phone, and there are millions of good morning messages, each mushier than the other, with more flowers and whatnot. That is a side aspect of WhatsApp, and it's up to you whether you want to send WhatsApp messages, again recycle those messages to other friends. But here we are here to talk about, can I use WhatsApp to enhance practice? There is a definite role for WhatsApp ethically to enhance practice. A colleague of mine has a list of patients' birthdays and wedding anniversaries in her phone, and she uses that early morning time usefully. She wakes up much earlier than I do, so she uses that early morning time quite usefully to send birthday greetings and wedding anniversaries greetings to them. She's also classified her patients into broad groups of Hindus, Muslims, Christians, and on appropriate religious festivals she sends them festive greetings as well. That is one way of doing things. What about patient queries? Patients, once they have your cell number, some people give it willingly. I don't give my cell number, but they get it nevertheless. So then they will send you a picture of their subconjunctival hemorrhage and say, what do I do for this? Or their conjunctivitis, and what drops should I put in the eye? And there is do's and don'ts over here. The thing is that anything serious you can't really advise, because if they follow your advice and land up with more trouble because of the poor quality of their photo, or because they don't have photo slit lamps in their homes, you could land up in an issue. So best is to tell them that please come to the clinic. If it's an obvious thing, it's an old patient of yours and you want to help them, you tell them there's nothing to be alarmed about. If it becomes worse, come and see me at the clinic. If you must give treatment for, say, conjunctivitis or something, then I normally prescribe an innocuous drop, not a fourth generation fluoroquinolone, and tell them to put it 3 times a day, which is a little bit of a homeopathic dose, and tell them if you're not better, do drop into the clinic in a day or 2. So they are not worse with your treatment. There's immediate issue is solved, and if they want to, then they can come to the clinic. How do we learn using WhatsApp? I think some of the professional groups, if they are professionally managed, are great learning experiences. People post their difficult cases, they post their their pentacams, their OCTs, and ask what would you do, or they tell you what they have done, and it's a great learning experience for everybody. So it's important to join such groups. They exist in the city, the state, the country, or by speciality. And nowadays, previously the WhatsApp was a very close group of 256. Now no longer, almost every WhatsApp group has got space for new members to come in. So you can join. Telegram has really not taken off the way WhatsApp has taken off. So I would restrict myself to WhatsApp. So you can also contribute interesting cases. You contribute 5 cases of uveitis, and people remember this, that you're basically a uveitis guy. When they have a uveitis patient, they might send it across to you. So you could enhance your practice as well. In the COVID times, we did use WhatsApp videos for teleconsultations. When there was lockdown and we are sitting at home, then a small percentage, I would say about 25% of the patients who called actually were willing to pay for their consultation. Now that COVID is over, that number have dropped because people expect things for free. If you are in WhatsApp groups, you need to follow certain etiquette, avoid foul language, try and stick to English in professional groups, because even if you are in a city group, remember that your city is quite heterogeneous and there are people who don't follow the local language. And there may be some people from internationally who are also part of the group. It's impossible for you to know all the 300, 400 people in the group. Avoid forwards under any circumstances in any professional group. No good morning, no goodbye, no whatever, unless it's extremely relevant and authentic. I mean, somebody has been hammered up in a hospital next to you. It's nice to inform the group members about something like this. And completely avoid comments on politics, politicians, religion and religious leaders, or even on national events in professional groups, because that tends to divide and that tends to turn people off. And at any given point you put a political comment, you'll find 20 people leaving the group. So avoid this. To keep the groups professional is not only the group leader's responsibility, but I think it's everyone's responsibility. Of course, avoid those clever, mushy forwards which I suspect have been created by the Vodafone type of companies itself. If you wish to greet someone on his special day or even every day, do it on his individual cell phone. So it's nice if somebody wins a gold medal at the AIOS and somebody else puts it up saying, "Congratulations, Dr. Maskati, on winning a gold medal." And then everyone else just uses that as information and sends congratulations to Dr. Maskati on his personal phone. He also feels good, and it doesn't clutter up the WhatsApp, because just deleting takes a lot of time. Also, when people put a surgery or a case report, 20 people will put a thumbs up to it because he writes 6-9 at the end of the thing. So it's quite, again, irritating for us to go through all the thumbs up which have no relevance. If you want to give him a thumbs up, use the reply privately option, and then a copy of his message and your thumbs up will go to him, so that he will know for what you have congratulated him. And always scroll up to confirm that you're not repeating a news item before hitting send. Because if you congratulated somebody and then you find that he's already been mentioned, or you wished happy birthday because you think you're the first and it's already been mentioned by people, just before you send something, just scroll up that particular group to see that nobody has done that before. And now we have the delete for everyone option, which I think is a great option. It remains there for quite some time. I think it's for almost 24 hours now. So if you have sent something in error, you do have a few hours in which to right click and say delete for everyone. There's delete for me, delete for everyone. So do click the delete for everyone button. Beware the university of WhatsApp. Avoid sending news to a professional group without verifying its authenticity. So we have excellent tools. We have Google, you have Snopes, you have a lot of things where you can verify that the news is authentic. Some eye surgeons have actually been killed prematurely on WhatsApp as well, and they are still alive today, and some of them are even attending the AIOC. So avoid killing people, avoid, in the urge to be the first, just verify that what you're saying is correct. But if you find unverified rubbish which floats around, I have a Rotary WhatsApp group. In fact, I have several such non-medical, I have friends, my school friends and whatnot. And somebody the other will post something which is absolute rubbish, or how they removed the eye from the mother and gave it to the child, and the child could see and the mother is blind, type of mushy, nonsensical stuff. Or some gadget which is promoted and every blind person can see. And in Australia they found this, you put the contact lens on and all blind people see. So all sorts of rubbish floats around. So I think it's our duty to correct that and say, and put in the group that as an eye surgeon, please don't believe this university of WhatsApp, and it's not true. So gently rebut these things with facts. Again, there are things which malign our profession as well, which we need to rebut on those groups, because if we don't do it, it just spreads like wildfire. And don't run down any other pathy, even homeopathy or Ayurveda or whatever. Don't run it down. Just don't comment on something like that unless it's harmful to the people who follow it over there. Then you can say that as an allopath, we don't believe in this sort of thing. But the moment you run it down, these homeopaths and Ayurveds get a more handle to it, and it backfires. So thank you so much. These are some of the few do's and don'ts for WhatsApp. Thanks.
Thank you, sir. Excellent as always, and there's a lot that all of us have to learn with group etiquettes as well. So I think I would also like to ask maybe Dr. Nikunj or one of the young people. There is a lot of pressure on younger doctors to share their phone numbers, and patients do want that WhatsApp. Would anybody want to comment if you do that and how you manage that?
Yeah. So you are aware that we started recently, like 2 years back, and our practice was absolutely zero, and then we have come up with. So initially, I was also reluctant, like sir said that because a few of my patients, I gave the number, and they were calling me anytime, any point of time, on Sunday, on night time, and I operated his wife for cataract surgery one eye, and the other eye has to be planned, but in between he was like going crazy with with small things that she's having this, she's having that. I mean, I cannot be 24/7 available just for one patient, and if I do that, I will not be able to have my own life, right? So then I stopped giving the numbers. But as you said that being a young person, so few of my patients felt that I'm not as available as they would want me to be available to them, and so I got another phone. I have a separate phone now. I carry it always with me. That is exclusively for patients. I have my visiting cards with that only number, and my personal number is never shared. I don't share it with my staff also, that they can also not share it with my patients. So I only share my particular number which is for the patients, and which is off after I am off from the clinic. That is the only way I found that it is working also. So patients I've told them that you put me on query on your WhatsApp, on my WhatsApp, because I may not be able to pick up your phone. You see that I'm busy, I might be in surgery, I will not be able to pick up your phone. You put your queries on WhatsApp, and when I get time, I'll get back to you, and that is working so far. That is the way.
But do you answer queries from your personal time or during clinic hours?
Only clinic hours, sir. So if somebody has sent me a message today, and if I'm not able to reach them back today, then I'll definitely reach them tomorrow, but only in clinic hours, not at home.
So the other thing to do is to tell them that would you like to GPay or would you like to? I do that. So if I as I said, I divide them into my old patients whom I know and whom we want to retain. And somebody new whom I've never heard of, who just messages from Ahmedabad to say, do you have treatment for retinitis pigmentosa? So it's like that. So then I ask them that, would you like to GPay for the consultation, and then you get a 10-minute video consultation with me? Or would you like me to share my bank details so that you can transfer? This is the amount that you need to transfer. And usually there's no return message. So, yeah.
I'll just share one of the strategies that I've taken up now, because again the same thing happened with me as well. Patients would call you for very trivial matters, and it really spoils your mood when you're out for a dinner, watching a movie. It's an unknown number, you pick up. So what I have done now is I have one phone, but I have a separate number on a WhatsApp business account. So with the WhatsApp business account, as soon as I get a message, it says, thanks for getting in touch, please let me know how I can help you, and I'll get back to you by the end of the day. For appointments, please call this number or visit this website, and no phone goes through on that. The phone is forwarded directly to the center. Okay. So patients cannot contact me. And I keep a fixed time at the end of the day where I reply to these WhatsApps. Because especially post-operative patients tend to get irritated if you don't get back to them.
And they tell you, doctor, give us your number. We promise not to call you unless it's a dire emergency. And the dire emergency is 2 drops of water fell out from the eye.